Hi, I'm Matthew Iveson. I'm from the University of Edinburgh. I'm going to be talking a little bit, very briefly, about some of our attempts as part of an MRC-funded mental health data pathfinder project in Edinburgh to create a large familial e-cohort explicitly using routinely collected data and data linkage. So it's probably no surprise to you that families are particularly important when it comes to understanding contributions to mental health risk and resilience. And most of the time, previous work has thought of this in terms of transmission of risk between individuals within a family. So for example, you get direct transmission through, for example, genetic risk between parents and children. But you also get indirect transmission of risk through, for example, behaviours exhibited by an individual living with mental health conditions and the effect that those behaviours have on people living with them. Very few studies have managed to look at this aspect of shared family circumstances as a kind of common cause. So the idea is that something like poverty can affect everybody in a particular family, and this might increase each family member's risk individually, but it might otherwise appear as transmission. It's quite hard to distinguish from transmission, and part of the problem is that we really want to disentangle an individual's mental health risk into different sources of risk. So for example, you could imagine separating out an individual's risk into things that could be attributable to their own life course, as well as things that could be attributable to other people in their family and the effects that they have, and also these shared sources of risk. But to disentangle this and separate it out appropriately, we actually need quite a lot of data, both in terms of the variety of measures to capture all of these different sources, but also the volume and complexity that we need to recreate family units at scale. And this problem of volume and variety can be solved using linkage of routinely collected data, both non-health and health data. So, for example, in Scotland, we use a lot of linkage between NHS data and National Records of Scotland data. And one of the benefits of this is that for each individual, we can effectively reconstruct their entire life course. So for example, socioeconomic conditions in their childhood, and as well as tracking their mental health across time, for example, into later life. And the other thing is that by reconstructing individual life courses, we can then combine these together, retaining family structure to then recreate life courses of each family member. And one of the data linkage at this sort of scale has a lot of benefits. One is that we can obtain a big sample, entire populations potentially. One is that it's very representative, so it avoids some of the participation bias that we get in some surveys. It manages to capture a lot of the variety of measures, both socioeconomic, health, both mental health and physical health, education, cognitive ability, and it's relatively cheap as well. So in this particular project, we start off with an easily traceable single-year birth cohort, which is actually the Scottish Mental Survey in 1947. We use this group of about 68,000 people as a base because we've used them quite a lot in the past, and we know that they're easily linkable in routine records. And what we've been doing during the Pathfinder project is tracing these individuals in historic birth records going all the way back to the 40s, and also historic marriage records to identify their children and spouses. And what we can do is then combine the original birth cohorts with the spouses and their children to form a family cohort, which can be used for research purposes. And we can link forward these cohort members in time to their own health records and to administrative records, such as from the censuses. And and again, retain this family structure in addition to individual data. I'm not going to talk anything about this slide. It's quite complicated. It's just to show you how difficult it is in terms of the mechanics of passing data between different organizations while trying to uphold data protection principles and protect individual identities. So the result of all this work is a large, complex e-cohort that incorporates multiple domains of measures while retaining family structure. One of the great things is it's longitudinal because these individuals were born in 1936. They're all older adults and so have a life course of administrative data that we can draw from. Their children likewise are adults now, so we have quite a lot of data for these people too. And it's probably worth pointing out that this e-cohort has a lot of potential. So firstly, we can add generations as required, but we can also build in additional data sources that we haven't captured in this first instance of the project. So for example, the Guthrie spots that Mark mentioned will be a very useful kind of addition to enhancing this sort of cohort. Also, we're working really hard to make this accessible to other researchers. It takes quite a lot of effort to trace all these individuals. We don't want that effort to be wasted, so we're leaving basically a cohort list on the NHS and NRS end of things. So future researchers will be able to just apply as normal for NHS or NRS data and request the specific cohort, and everything should be taken care of for them. And there's a lot that could be done with this sort of cohort. We have some example research questions, but you can undeniably think of more, and hopefully you'll be tempted to use it in the future. One of the things we're interested in is partitioning out these shared contributions to depression risk and understanding just how important shared contributions can be to different family members. The other is trying to map the transmission of major depressive disorder across time, both in terms of its timing and in terms of its direction of transmission. And also looking at resilience to depression following kind of shared stresses, for example, bereavement. Everybody in the family would feel bereavement at the same time, and some members of the family may be more resilient than others, and so that's quite an interesting topic of research, I think. That's me. Thanks very much.
Matthew, thank you very much indeed for a fascinating talk. Maybe I can chip off with a question or two. This is huge. The slide you present in terms of what has been achieved does not do any credit to the sophistication and the amount of effort and work that's gone beneath this. Can you give first of all, can you give us some indication as to how long it's actually taken to do this, to get to this stage? And secondly, maybe can you separate out the differences between family structures and household structures? Because we know that most people are, throughout the rest of the UK, are struggling even with households, but to put families together is a step further again. Sorry, that's a mixture of questions for you.
Yeah, no, that's fine. Yeah, so in terms of the complexity and effort, it has taken us 2.5 years of Pathfinder time to achieve this. It definitely wasn't helped by the COVID situation, because to do this sort of tracing of individuals in historic records has required a lot of National Records of Scotland time. And obviously, when a big pandemic comes up, national agencies like that get drawn to do other things and priorities get changed, which is very understandable, but has meant that we have been delayed somewhat. Going back to the other point,
households versus
yeah, it's difficult. So the reason that we have decided to use, the reason that I've been careful in saying family members is because the best way of tracing individuals is in marriage and birth records. And the obvious limitation with that is that we don't necessarily know whether those people are cohabiting. We would really need a census for that sort of information.